Are home cervical traction units good for neck pain? And if so, which one is best? Hi, I'm Dr. Dave Candy, and in this video, I'll compare 3 different types of home cervical traction units and let you know the advantages and disadvantages of each. Before we compare the specific devices, it first helps to understand just what cervical traction is used for to begin with, and if cervical traction in general or home cervical traction are of any value. Cervical traction is typically used in the clinic for pinched nerves in the neck, where the vertebrae have come closer together, or there's a herniated disc pushing on a nerve root, and you're getting symptoms going down into your arm. There are really expensive mechanical devices at chiropractor or physical therapy offices. And if we look at the research for cervical traction, there is some very slight evidence to indicate it may be helpful for short-term pain relief, but there's really no great evidence indicating that it's good for improving function or quality of life. So really, home cervical traction is just a pain relief mechanism. But some of the units are very inexpensive, and so sometimes short-term pain relief is a good thing. And that's where home cervical traction units can be quite helpful. And in fact, there was a retrospective study that showed that 81% of patients who used a simple over-the-door home cervical traction unit for 5 minutes twice a day did in fact feel it was beneficial. Now, just to let you know, I have no preference as to which one of these devices you use. This is not a sponsored video. It's just to give you an idea of the comparison of the many, many different products out there on the market. The first one I'll show you is by far the most expensive. I did get it for free from a vendor, but I'll give you a spoiler alert, it's my least favorite out of the 3. And that one is the DDS Max Cervical Decompression Unit. Now, in general, I'm a big fan of DDS products. I really like their lower back decompression brace and their knee arthritis braces, and I've done separate review videos on both of those, but this one was just a little off the mark for me. You put it on by unfastening the Velcro, and then you just put it right underneath your chin. It kind of looks and feels a little bit like a solid neck collar that you would get after a car accident. And I should note that if you've had a car accident or neck trauma, or if you have dizziness, nausea, blurred vision, if you can't turn your head about 45 degrees in either direction, or if you have hypermobility disorders such as Ehlers-Danlos or rheumatoid arthritis, it would be a really good idea to check in with your doctor before using any type of cervical decompression unit. Now, this one has a pump that attaches to the brace through a valve, and it inflates the brace to lift up on the neck. You pump it up by pushing the handle back and forth, and you can start to feel it lift rather quickly. You want to pump it up until the dial is in the green section or perhaps in the yellow, but you definitely don't want to go into the red or caution. Now, I'll let you know that with this one, it feels like it's choking me a little bit, so I really don't like that. Additionally, it does kind of kick back into extension a little bit. So for that reason, I'm not a huge fan of this one. However, it is an option. You can unclip the pump just by pulling that off, and then you can walk around and do your daily activities with the brace on. Like I said, this one isn't my favorite. It feels a little bit uncomfortable to me, but I just wanted to share it because it is one that's out there on the market. To take the pressure off, you just twist the valve like that. It lets the pressure off almost immediately, and then you just unstrap the brace. The next option is another inflatable brace that goes around your neck. This one has 2 Velcro straps, and you just put it on there and there, and then it inflates kind of like an accordion. It's got a pump just like a blood pressure cuff, so you want to make sure the pump valve is closed, and then you pump it up. Now, I will let you know when you first get this out of the package, it takes quite a while to pump it up. I think this started partially inflated because I've already inflated it a little bit, but you can still see it's taking quite a while to pump up, and I really don't feel anything as far as a traction force yet. It is really comfortable. I didn't notice any like choking or squeezing with this one, but even as it starts to get a little bit more inflated, I still really don't feel anything as far as a traction force. So you really do have to get this one inflated pretty heavily. So we'll keep going here, keep pumping, and keep getting it more inflated. It's not necessarily a fashion statement, but if you're just wearing it around your house, who really cares what it looks like? If it helps you go around and do things a little bit more comfortably. Now it's just starting to get pressure on, starting to lift up a little bit, but still really not extensively. The nice part about this is it does have an opening here for your chin, so you definitely don't feel like you're choking. You can talk and breathe rather easily. But again, it's not a huge distraction force either. I still don't feel a whole lot of distraction. It is unloading the back of my neck, and because this is open, it does force you down into a little bit more flexion, which opens up the spaces in the back of your neck where the nerves come out and where the muscles are. So it's a nice little stretch. I wouldn't say I feel a substantial amount of traction even with it inflated this much. And from other people that I've known that have tried these devices, they get kind of the same one. So this is a much gentler traction force. It's much more comfortable than the other one, but it probably isn't quite as effective either as far as the absolute amount of traction force. To let it out, just like the other one, you untwist the valve and then it comes down. This one does not let the pressure out quite so quickly, but really you can just take this off. The final one is the over-the-door cervical traction unit. And this one definitely takes the most front-end work to get set up. To get it set up, you fill the water bag at the sink. I usually tell people to start out at around 10 pounds. Setting up an over-the-door traction unit is pretty easy to do, but it can be a little bit intimidating because there's a lot of parts in the box. The instructions are right on the box, but it's a little bit easier if you can see someone just walk you through it. So essentially you'll take this triangle piece and this hook piece. This is what's going to go over the door. And you want to put the peg right here inside the little hole in the bottom of this piece here. You want to put the notch right here. I don't know if you can see it. You put that in sideways and then you're going to have to kind of turn it. Now you'll notice this doesn't quite fit. You have to squeeze it just a little bit with your hand and then you fit it through the hole there and then everything's in its place. Now you pull the pulleys so that they line up. There's a notch here and a notch here, and one pulley should be on each side of the notch. Then you'll put this part over top of the door like that. Then you'll want to shut the door so that it stays in place. Next, you'll take the string that comes with it and you'll unwind it. Just place that through the pulleys like this. Get it kind of even there just to balance. Now the next step is you're going to put the one end of the string through here and then just tie it securely in place. You can use whatever type of knot you want, just so long as it doesn't come loose. Next, you need to attach the other end of the string to the water bag. Now it's important that you get the tension right on this because if there's not enough tension on it, then there's going to be no downward pull force to pull upwards on your neck. So it is important that you get this tight enough. I usually tell people to bring it up on the floor so the hook is all the way up at the top, pull a little bit more tension on it, and then actually bring it up just a little bit higher than that before you secure it into place. You don't want to have that come down on your head, so it's probably a good idea to do this standing up rather than sitting in the chair, and then just loop it around like this. And if you get the tension right, the bag should be just a little bit off the floor when the hook is up at its highest. Next, we want to attach the head harness. Pull the unit down around your head like this. And then you fasten the straps on underneath your chin right there and right there. Now if you've got everything set up correctly, the traction force should pull upwards through your chin while the water bag hangs behind the chair. But you may notice that if you're pulling up like this, the traction unit actually has an upward pull like that on your head, which pulls you back into neck extension, which is really the opposite of what you want because that jams the joints together in the back of your neck, and it also closes the spaces where the nerves come out. So I often tell people to turn their chair around the other way and sit facing towards the door, where the traction unit has an up and forwards pull on their neck. Now, the definite disadvantage of this one is that you're fixated to a door, so you can't go anywhere with it. As far as the advantages, I do think this one actually offers the best pull. It gives an upward and forwards pull. It has an adjustable amount of pull, and it actually feels like it's pulling my head without being incredibly uncomfortable. If you do have TMJ or some other type of jaw pain, it does pull up through your jaw, so you just have to be a little bit careful about that. The other nice thing about this is you can actually do some exercises, like doing some cervical range of motion exercises with your head weight unloaded, or doing arm exercises with the weight of your head unloaded. Now you'll notice here the water bag only goes up to 20 pounds, and they've actually done studies showing that it takes about 25 to 30 pounds to actually get distraction in the lower parts of the neck. And that's in supine or laying down traction, like a Saunders unit that you'd see in a clinic. And they do actually have those for home as well. I'm not a huge fan of those, and the reviews I've gotten from patients aren't that great. They cost at least $300, and they can sometimes be a little bit uncomfortable up there. I've heard people say that they sometimes slip off and they don't get a great pull force. So for that reason, I'm not a fan of the Saunders unit, but that is another option. As far as the unloading weight though, none of the three devices that I reviewed in this video actually probably really get up to that 25 to 30 pounds of unloading force to separate the lower parts of the cervical vertebrae. So what's the advantage of a cervical traction unit at home if it doesn't unload your neck to get distraction in your joints? Well, really what it does is probably more deload rather than stretch. So it takes some of the force off of your muscles so that you can move and do other things with your arms without as much pressure of gravity pushing down on your neck. And that's another reason why I do like this one, because you can practice going through motions that you might otherwise have difficulty doing, like neck rotation or arm raises while wearing this brace. So I'll put links to all three of these products down in the product description. Again, I have no preference as to which one you use or if you don't choose any of them at all, but I just wanted to show you the various options out there. As I mentioned before, home cervical traction units are probably good for short-term pain relief at best. If you'd like a longer-term solution, you probably have to do things like working on your posture, checking out your sleeping position, and doing certain exercises to undo the postural dysfunctions that you accumulate throughout the day. Now, if you'd like more tips to relieve neck pain, I've got a whole chapter of neck pain tips in my book, Chronic Pain, You're Not Just Getting Older, You're Not Crazy, and It's Not All in Your Head. And we've got more neck pain tips in this playlist up here. But before you go check those out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.